The wounded soldier came through the doors like something dragged out of a war zone, which was exactly what he was. 210 pounds of muscle and combat trauma, thrashing against the gurney straps, knocking an IV pole sideways, and screaming in a language that wasn't English. 3 orderlies couldn't hold him. A security guard had his hand on his taser. Dr. Gareth Holloway, chief of the trauma bay at Callaway Regional Medical Center, was already shouting for sedation when a nurse nobody paid attention to stepped past the crowd, leaned down close to the soldier's ear, and said something so quiet that nobody else in the room heard it. The soldier stopped moving, not gradually, not after a second or two. He stopped like someone had cut the power. His eyes found her face, and whatever he saw there made his expression break open in a way that had nothing to do with pain. "Ma'am," he said, barely above a whisper, "that can't be you." Every person in that trauma bay froze. If you want to find out what that soldier knew and what it cost everyone in that hospital to finally learn the truth, stay with me until the end. Subscribe if you haven't already, hit that like button, and drop a comment telling me what city you're watching from. I want to see how far this story travels. The shift had started badly, the way most Tuesday nights did at Callaway Regional. Rachel Darrow showed up at 6:47 p.m., 13 minutes before her shift officially started, because she always did. She kept her scrubs clean, her hair pulled back tight, and her face in a neutral expression that some of her coworkers had decided meant she thought she was better than them, when in reality, it meant she was tired in a way that sleep didn't fix. She was 29 years old and had been working the ER floor at Callaway Regional for just under 2 years. She had no drama, no complaints on file, no close friends on the unit. She clocked in, checked the board, and started doing her job. The thing about Rachel was that she didn't broadcast herself. She refilled supplies without being asked. She updated charts with a precision that the charge nurses appreciated but never mentioned out loud. When a patient was scared, she explained things clearly and without condescension, which was rarer than it should have been. She did all of this quietly, and because she did it quietly, most of the medical staff at Callaway didn't know what to make of her. Some of them had decided she was meek. A few of the residents had decided she was a pushover. One of the attending physicians, Dr. Gareth Holloway, had decided she was background furniture, which was his general attitude toward nurses who didn't push back when he was dismissive, and Rachel had never once pushed back. She had her reasons. The board showed 17 patients waiting, 2 in critical, 1 incoming trauma activation. Rachel pulled the activation chart and started reading. 23 minutes later, the ambulance bay doors blew open. She heard him before she saw him. The noise was specific, not crying, not calling out for help, but a kind of controlled rage that people who'd never been trained for combat wouldn't recognize. Rachel recognized it. She set down her chart and walked toward the sound. The gurney came through fast, pushed by 2 paramedics who both looked rattled, which took something significant to achieve. The man strapped to it was large, dark-haired, with a field dressing on his left side that was soaked through and a splint on his right forearm that had been applied in a hurry. His eyes were open and moving, cataloging exits and threats with the automatic efficiency of someone whose brain had been doing that for years. The restraint straps across his chest were straining. He'd gotten one wrist halfway loose already. "GSW, left flank, possible pneumo," the paramedic leading called out. "He's been like this since pickup. Won't let us touch the wound site, nearly broke Enver's wrist back there. Get away from me." The soldier's voice was rough, accented with something regional that Rachel couldn't immediately place. He wasn't panicking. His voice was controlled even through the aggression. That was the part that mattered. "I said, get your hands off." Dr. Holloway materialized at the foot of the gurney with 3 residents behind him, which was the kind of entrance Holloway liked to make. He was 51, silver-haired, and operated with the particular authority of a man who had never seriously questioned whether he was the smartest person in a room. "Okay, what are we dealing with?" Holloway said, not phrasing it as a question. "He's combative. Won't allow assessment. We think he was..." "Sedate him. His BP is already low. We don't know what he..." "I said sedate him. Someone get security." The security guard was already there, one hand on his taser, watching the soldier's half-free wrist with professional concern. A resident moved toward the gurney with a syringe, and the soldier's head came up with a speed that made everyone step back involuntarily. "Touch me with that." and I'll put you through the wall, the soldier said. He meant it. Every person in the room could hear that he meant it. I know where I am. I don't need to be sedated. I need someone who knows what they're looking at. Sir, you need to calm. Don't tell me to calm down. His jaw was tight, sweat on his forehead, color draining from his face, but his eyes still clear and scanning. He was holding on by sheer will. There's something wrong with the entry angle. The pressure in my chest isn't right. Whoever you're about to send in there is going to make it worse. I need someone who... He stopped. His eyes had found Rachel. She hadn't pushed to the front of the crowd. She was standing just past the edge of the main cluster of staff, close enough to see him clearly, and she'd been watching him the way she watched everything. Still, attentive, reading. He looked at her for one full second, the way soldiers looked at other soldiers, and then she moved forward. Rachel. One of the other nurses, Deanna, caught her arm. Holloway's running this. I know. Rachel kept walking. She reached the side of the gurney, and the noise in the room seemed to settle slightly just from how she moved, which was not a small thing. She didn't reach for the wound site. She didn't pick up the chart. She leaned forward, close to the soldier's ear, and she said something. 4 words, maybe 5, spoken below the threshold of anyone else's hearing. The soldier went completely still. Then his eyes, which had been hard and defensive and scanning since the moment he came through those doors, found her face again. And something in them changed, not relief. It was more complicated than relief. It was the specific expression of someone who has just seen something they believed was permanently gone. Ma'am, he said. The word was careful, almost reverent. That can't be you. The entire trauma bay went quiet. Rachel straightened. Her voice was calm and professional and gave away nothing. Let them take vitals, she said to him. I'll stay. He nodded once. Lay back. The room collectively exhaled. Holloway recovered faster than most. He was good at that, moving from confusion to authority without passing through uncertainty in any visible way. Someone explain what just happened. Nobody answered because nobody could. Bennett. He turned to look at Rachel, who was already checking the field dressing with gloved hands, her eyes moving over the wound with an attention that wasn't standard nursing protocol. Her name on his lips had a particular flatness to it, like he was identifying a piece of equipment. Step back. Let the residents assess. His breath sounds are unequal, Rachel said. She hadn't looked up. Left side is diminished. The field dressing was applied over an exit wound, not entry. The angle of penetration is different than what the paramedics thought. If you needle decompress on the right, you'll... Thank you, Holloway said, with the particular tone that meant the opposite. I didn't ask for a nursing assessment. Step back. Rachel straightened and looked at him. She held the look just long enough for it to register that she'd chosen to comply rather than been forced to, then moved back 2 steps. Holloway turned to his senior resident. Dr. Price. Left side needle decompression, standard approach. Sir. The resident moved forward with a needle. From the gurney, the soldier's voice came out flat and precise. Don't. Price hesitated. She's right about the angle. The soldier's eyes were still on Rachel. I watched it happen. The round came in from the left, traveled right. Exit wound is, Sir, I need you to stop talking and let us work. I'm telling you. Security, I need the patient restrained. Hey. The soldier's voice sharpened. Hey, I am talking to you. Look at me. She's right. You're about to do the wrong thing. Mr. Holloway glanced at the chart for a name. Mr. Voss, I understand you're frightened. I'm not frightened. Daniel Voss said it the way someone states a fact about weather. I'm telling you, your assessment is wrong and your nurse is right, and if you go in on that side, you're going to collapse what lung I have left. I've seen it happen. I know what it feels like. A pause. His breathing was audibly strained now, and the effort of talking was costing him, but his voice stayed level. She knows what she's doing. I don't know how she's here, but she knows. Holloway looked at Rachel. This is your patient, he said. The question was almost satirical. He's your patient, Rachel said. I'm just telling you what I'm seeing. And what you're seeing contradicts my assessment. Yes. The honesty seemed to briefly catch him off guard. Then his expression closed back down. "Price," he said. "Proceed." What happened next happened fast. Rachel moved forward again without permission. She put herself between Price and the gurney. Not aggressively, not with any drama, just planted herself in the space and looked at Holloway with a steadiness that stopped Price cold. "If you decompress on the left, you'll hit the exit track," she said. "The tension is on the right. I know it doesn't match the presentation pattern you'd expect, but it's a through and through with a deflection. The round hit something before entry, changed angle. The right side is where the pressure is building. If you want to verify without imaging, listen again. Put the stethoscope against his right axilla and tell me what you hear." Silence. Holloway didn't move. One of the other residents, a young woman named Dr. Ferris, who had said nothing so far, slowly reached for the stethoscope around her neck. She caught Holloway's eye. He gave her nothing. No permission. No denial. She pressed the chest piece against the right side of the soldier's chest and listened. Her face changed. "Dr. Holloway," she said carefully, "the right side is—" "I heard her assessment," Holloway said. His voice had gone tight. "She's right," Ferris said. She said it quietly, like she knew the cost of it. "Right side tension. We need to decompress right." A beat. Holloway looked at Rachel. His expression was something she'd learned to read in people like him. Not embarrassment, which would have required a kind of self-awareness he'd long since moved past, but the specific anger of someone who has been made to look wrong in front of an audience. "Fine," he said. "Right side. Price." He said nothing to Rachel. He moved away from the gurney without acknowledging that she'd been correct, because acknowledging it would have cost him something he wasn't willing to spend. Price decompressed the right side. The difference was immediate. Daniel Voss's breathing evened out within 90 seconds. His blood pressure, which had been in free fall, began stabilizing. He didn't say anything during the procedure. He just kept his eyes on Rachel, who stood where she was and watched the monitors until the numbers started moving in the right direction. "You should go," Holloway said to her. He'd come back to stand behind her, and the words were quiet enough that the residents couldn't clearly hear. "You've helped. You can go back to your assignment." "He asked for me to stay," Rachel said. "He's a patient under anesthesia protocol. He doesn't get to direct nursing assignments. He's conscious and hasn't been sedated." She turned her head to look at Holloway directly, and for a moment something in her face shifted. Not anger, not defiance. Just a particular steadiness that some people found unnerving because it didn't respond to social pressure the way most faces did. "And his vitals are still volatile. The field injuries haven't been fully inventoried. I'm aware of my patient's status, thank you. His right forearm splint is compressing the radial nerve. The angle of application is wrong, probably done under stress conditions. If it stays on much longer, he risks compartment syndrome." A pause. Holloway didn't look at the arm. "I'll have it assessed. I can adjust it now. 2 minutes." "What I need you to do," Holloway said, and his voice had dropped further, to the register that was meant to feel like a final warning, "is return to your other patients and allow the trauma team to do their jobs. You're a nurse, this is outside your scope." Rachel looked at him for a moment. Then she looked at Daniel Voss, who was watching the exchange with the focused attention of someone running probabilities. "I'll check back," she said to Voss. "No," Voss said clearly. "You won't leave." "Sir," Holloway started, "I'm not going to be treated by anyone in this room unless she's here." Voss's voice was controlled and clear, despite the oxygen mask now sitting loosely around his neck. He wasn't being irrational. He wasn't demanding in the way of someone who was scared or confused. He was stating a condition. I understand how it sounds, but I've been through 3 combat deployments and I know what a competent medic looks like, and she's the only one in this room who caught what was actually wrong with me. So, she stays, or I sign out AMA. You cannot sign out AMA in your current condition. Watch me. The monitor beeped. His blood pressure dipped 2 points. Holloway looked at the board, then at Rachel. His expression said very clearly that this was her fault, the patient's unreasonableness, the deviation from normal workflow, all of it, hers. "Fine," he said, for the second time in 10 minutes. "Stay. But you're here as an observer. You do not touch the patient without my direct order. Is that understood? Understood, Rachel said. She meant it differently than he heard it. The next 40 minutes moved the way ER time always moved, in compressed, sideways increments where things seemed slow until they weren't. Rachel stood where she'd been told to stand and watched Daniel Voss get assessed, and she watched the residents work, and twice she quietly flagged something to Dr. Ferris. Once about a laceration on his shoulder that had been temporarily overlooked, once about his pupil response on the left side being slightly slower than the right, which she said without explanation, and which Ferris relayed to Holloway, who ordered a CT of the head without acknowledging the source. The other nurses on the floor had opinions. She could feel them from across the room. Deanna kept giving her a look that was some mixture of admiration and anxiety. A charge nurse named Pete had already come by once to suggest she return to her assigned patients, and she'd explained calmly that she was covering Bedford's vitals remotely and that both of her other patients were stable, which was accurate, and which Pete couldn't technically argue with. The residents had sorted themselves into two camps. Ferris had stopped looking at Rachel sideways and started treating her observations as information. Price had decided to pointedly not look at her at all, which was its own kind of acknowledgement. Voss was more alert than he'd been on arrival. The decompression had brought him back from the edge, and the secondary wounds were being cleaned and closed, and his blood pressure was holding. He'd answered the standard neuro questions correctly, and with a dry precision that suggested he found them mildly insulting. He was watching Rachel when he wasn't watching the work being done to him. She came to the side of the gurney during a lull, checked the splint, and started to loosen it by 2 degrees. "You know I'm going to get yelled at for that," she said quietly. "Probably," he agreed. His voice was rough with fatigue but steady. "How long have you been here?" "At this hospital? Almost 2 years." His eyes moved over her face. He was doing the thing soldiers did, reading someone's history and their posture and their hands and the specific way they held themselves when pressure was being applied. "That's not what I meant." "I know." She finished adjusting the splint and stepped back. "You should rest. Your BP is still lower than I'd like." "Rachel Darrow," he said. Not a question. She went still. "It took me a minute," he said. "You look different, the hair and—" He stopped. His expression had gone careful in a way that pain alone wouldn't explain. "I wasn't sure, but the phrase. Nobody else knows that phrase." "Nobody should," she said quietly. "It was retired." "Then how did you—" "I remembered it." She glanced toward the main cluster of staff who were occupied with equipment and documentation. She kept her voice at the level of a private conversation. "You need to stop talking. Your oxygen sat is doing fine, but you've been using your intercostals to compensate, and you've been doing it since you arrived. And if you keep running your mouth—" "You saved us," he said. "On Black Horizon. You were the medic. You saved—" "Daniel." Her voice was quiet and flat and did not invite continuation. He closed his mouth. She adjusted the oxygen sensor on his finger, which didn't need adjusting, and straightened and walked back to her position at the edge of the bay. But her hands, as she smoothed the front of her scrubs, were not entirely steady, and the expression on her face, for just a moment before she got it back under control, was not the neutral professional distance she'd been carrying for 2 years. It was something that looked like a door she'd been keeping locked, suddenly developing a crack along its seam. By the time Holloway came back to the bay 40 minutes later with the CT results, Daniel Voss had told 3 of the nurses around him that he needed to speak with hospital administration. He'd said it politely and clearly and twice, which meant it was going into the record whether anyone wanted it to or not. Holloway stood at the foot of the gurney with the CT results in his hand and delivered them to Voss in the clipped, information-dense summary style he used with all patients, which was technically thorough and interpersonally somewhere between brisk and cold. The chest decompression resolved the tension pneumothorax. Left flank wound is clean through and through, no major vessel involvement. The head CT is a pause, small enough that only someone paying attention would catch it. Clear, no intracranial involvement. Good, Voss said. We'll be moving you to a monitored room for the night. Standard protocol for— I want to speak with your hospital administrator, Voss said. Tonight. Holloway's expression didn't move. This can be addressed tomorrow when— Tonight. He said it the way someone says it when they've already factored in all the counterarguments and found them insufficient. I also want Rachel Darrow assigned as my primary nursing contact for the duration of my stay. Nursing assignments are made by the charge. I'm aware of how hospitals work. I'm asking you to make the request. He met Holloway's eyes, and there was something in his gaze that had nothing to do with being a patient in a hospital bed. It was the gaze of someone who knew exactly how to read a power structure and exactly how much weight his own position carried. I'm also asking you to document that she correctly identified the injury pattern that your team missed, because that's going to come up. A silence. Mr. Voss, Holloway started. I'm not making threats, Voss said. I'm telling you what's going to happen. People are going to come here, and they're going to want to know what happened tonight, and they're going to look at the documentation. I'd like the documentation to be accurate. Holloway looked at Rachel. His gaze had changed quality. He was recalculating something. I'll pass the request to the charge nurse, he said finally. Regarding administration, I'll have someone reach out in the morning. Tonight, Voss repeated pleasantly. Please. Holloway left without responding to that, which was its own kind of answer. Rachel came to the gurney when he was gone, replaced the partially dislodged oxygen sensor, and didn't say anything for a moment. You didn't need to do that, she said. Yeah, I did, he said. I've been doing this long enough to know that people like him don't change unless something forces them to. A pause. And because you shouldn't be standing in the corner of a trauma bay you saved someone in, getting treated like you don't know anything. She looked at him. You don't know what you're starting. I know exactly what I'm starting. The monitor beeped. His sat dipped fractionally, then recovered. Rest, she said. He didn't argue this time. He lay back, closed his eyes, and his breathing slowly evened into something that was less labored. She watched the monitor for 60 seconds, making sure the trend held, and then she walked away. Focus. The charge nurse, a 20-year veteran named Sandra Okafor, who ran the floor with the calm efficiency of someone who had seen everything twice, found Rachel in the supply closet at the end of the corridor doing inventory, which was not Rachel's assigned task, but which needed to be done, and which Rachel had apparently decided to handle. You want to tell me what that was in there? Sandra said. Not unkindly. I identified an injury pattern, Rachel said. She counted syringes without looking up. Standard assessment. You planted yourself in front of a resident who was about to work on the attending's direct order. The assessment was wrong. I know. Sandra leaned against the doorframe. Ferris told me, off the record. She said you were right. A pause. Holloway's going to write you up? Probably. You're not worried about that. Rachel set down the syringe count, turned around, and looked at Sandra. Her expression was even. I'm worried about a lot of things. Holloway's write-up isn't one of them. Sandra studied her for a moment. The patient. He knows you. It wasn't a question. Sandra was too good at her job for questions she already knew the answer to. We've met, Rachel said. He asked for you specifically, made a formal request to the attending, which you know is going to go places neither of you probably want it to go. I know. And you're standing in a supply closet counting syringes. Someone has to. Sandra shook her head slowly. I'm going to assign you to him officially, because he asked, and because his condition warrants familiar staff continuity, and because, frankly, Holloway's assessment record tonight is going to get scrutiny, and I want someone competent at that bedside. She paused. But Rachel, if there's something about that patient that I should know, he's a trauma patient who needs monitoring and rest, Rachel said. That's what you should know. Sandra looked at her for another moment. Then she nodded, once, and left. Rachel turned back to the syringes. Her hands were shaking slightly. She pressed them flat against the shelf and held them there until they stopped. 11 minutes later, the alarms went off. She was already moving when she heard the first one, because she'd checked his numbers on the hallway monitor on her way back from the supply closet. And his pressure had been trending down for the past 4 minutes in a pattern she didn't like. And she'd been walking fast before the alarm confirmed what she'd already suspected. She came through the monitored bay door at a run. Daniel Voss was seizing. Not a grand mal. No dramatic convulsions, just the rigid, eyes-rolled-back stillness of a focal seizure that was spreading, and his blood pressure on the monitor had cratered, and his oxygen sat was dropping faster than the alarms had time to register. Ferris was already in the room. Price was behind her. Holloway wasn't there yet. "BP's 58/30, Ferris called out. "He's going to arrest—" "No, he's not." Rachel was at the bedside, pulling the blanket back, hands going to his abdomen. She pressed carefully, systematically, in the specific pattern of someone who wasn't examining for pain response but for something else. The CT was clear, but it was only one pass. He's bleeding internally. The flank wound tracked differently than the imaging showed. The exit point shifted the trajectory of the secondary bleed. It's been building for the last hour, and it's pooling in the retroperitoneal space. We can't know that without— Feel. She took Ferris's hand and placed it at the specific point on the left flank, slightly lateral and superior to where the field dressing had been. "Right there. That's a fluid wave." "That's a bleed," Ferris pressed. Her face went still. "She's right," she said. "We need surgery now." "Where's Holloway?" Price said. "Get him here," Rachel said. Her voice was calm and sharp at the same time, the particular cadence of someone who had made decisions under conditions where the stakes were not theoretical. "And get OR on standby. He needs an emergency X-lap, and he needs it in the next—" She looked at the monitor. 7 minutes, she said, "or we're not going to have a patient to operate on." Price was already on the phone. Ferris was calling for blood products. Rachel positioned herself at the head of the bed and maintained airway, kept her eyes on the monitor, kept track of the elapsed time. Holloway came through the door 60 seconds later. He took in the scene, took in the numbers on the monitor, took in Rachel at the head of the bed. "What happened?" he said. Ferris told him. Efficiently, accurately, and with Rachel's assessment intact in the summary. Because Ferris was learning that removing it had consequences. Holloway looked at the monitor, looked at Voss, looked at Rachel. His face went through something complicated. "Get the OR," he said. "Now. And get me ultrasound, but I want to confirm—" "We don't have time to confirm," Rachel said. Not loudly, not dramatically, just clearly. "His pressure is at 54. Every minute we spend imaging is a minute the bleed expands. You need to decide." Another silence. The monitor beeped steadily, urgently, in the background. Holloway was a lot of things. Dismissive, territorial, difficult, but he was also a surgeon who had been doing this for 23 years, and some part of him, past the ego and the hierarchy, knew what impending arrest looked like. "Or," he said. "Let's go. Now." The room mobilized in the way that only comes from real emergency. Fast, purposeful, without the noise that comes from uncertainty. The gurney moved. The doors opened. Rachel stayed close to the head of the bed as they moved into the corridor, monitoring his airway, watching his color, counting his breaths. She was going to be pulled from the case the moment they hit the OR doors. She knew that. Nurses didn't scrub into emergency surgery without a specific role, and Holloway wasn't going to give her one. But she kept walking alongside the gurney anyway, because the 7 minutes she'd estimated were down to 5, and right now what Daniel Voss needed was someone who wasn't going to leave his side until he was through those OR doors and in the hands of someone she'd decided she could trust. In the corridor, with the fluorescent lights passing overhead and the wheels of the gurney loud on the tile, his eyes opened. Not fully. Not the sharp alertness he'd had earlier, just enough to find her face. She held his gaze. "Still here," she said. His hand, loose at his side, moved once. Just a slight adjustment of his fingers, the gesture someone makes when they're trying to reach something they don't quite have the strength to reach. She put her hand briefly over his. Then they hit the OR doors, and the surgical team took over, and the doors swung shut between them, and Rachel stood in the corridor alone, her hand at her side, the sound of her own pulse loud in the sudden quiet. Down the hall, she could hear someone asking where she'd gone. She didn't move yet, because 30 feet away, on the other side of those doors, was a man who knew something about her that she had spent 2 years trying to put behind her. And when he came out of that OR, if he came out of that OR, that thing was going to come with him. And she'd seen what Holloway's face looked like when he'd stopped dismissing her and started calculating. She'd seen the way Price had stopped looking through her and started looking at her. She'd seen Ferris's expression when she'd been right again, And again, and again. Something was already moving. She hadn't started it. Maybe Voss had, or maybe it had started the moment she'd walked through those ER doors 2 years ago, with her past folded up and tucked behind the ordinary face she showed the world. Either way, it was moving now. She pressed her back against the corridor wall and waited. The corridor didn't stay quiet for long. Sandra Okafor found her 12 minutes later, still standing against the wall outside the OR, and the expression on Sandra's face was the one she reserved for situations that had moved past nursing management and into something larger. "Administration's been called," Sandra said. "Holloway made the request himself." Rachel looked up. "That's fast." "Patient made demands before he went under. Voss apparently gave someone a name, a contact, and asked them to be reached immediately if his condition changed." Sandra paused. "The number he gave has a government area code." Rachel said nothing. "You want to tell me who this man is?" "He's a patient," Rachel said. "Who's in surgery?" Sandra studied her for a long moment. The OR doors were still closed, the status light above them red and steady. Somewhere inside, Holloway was doing the one thing he was genuinely good at, and Rachel was standing in a hallway hoping that would be enough. "Doctor, Holloway also filed an incident report," Sandra said. "Against you." "I know. It cites insubordination and scope of practice violation, specifically the moment you blocked Price from the patient." "I know what it cites." "Rachel," Sandra kept her voice low and even, "I'm not here to lecture you. I'm here to tell you that you need to go on record before he sets the narrative. If you want HR involved, it needs to be tonight, not tomorrow, when Holloway's had 8 hours to shape the story." Rachel looked at the OR status light. "When he's out of surgery," she said, "I'll deal with it when Voss is out." Sandra exhaled through her nose, not frustrated, something more like resigned to the shape of the person she was dealing with. "I'll cover your floor assignment for the next hour. After that, I need you back on rotation." She turned to go, then stopped. "He would have died. You know that. If Price had gone in on the wrong side." "Probably," Rachel said. "Not probably." Sandra shook her head. Ferris said it. "Definitely." She walked away without waiting for a response. Rachel leaned her head back against the wall and stared at the ceiling. The thing about being right was that it didn't protect you from anything. It didn't undo the incident report. It didn't change the way Holloway had looked at her before he'd gone into that OR, the recalculation happening behind his eyes, sorting her from nuisance into threat. Being right, in Rachel's experience, was often precisely what made things worse. People who were wrong didn't like being corrected. People with authority who were wrong liked it even less. And Holloway was a man who had built his professional identity on never being the one in the room who'd missed something. She'd made him the one who missed something. In front of residents, in front of a patient who was now actively requesting documentation of the error. The incident report was only the beginning. But the surgery took 2 hours and 18 minutes. Rachel didn't wait the whole time. She went back to her floor at Sandra's hour mark, checked her patients, updated charts, handled 2 new admissions with the mechanical efficiency of someone whose mind is operating on 2 tracks simultaneously. She did her job. She did it well. She did it in the way she'd been doing it for 2 years, invisible and competent, and careful not to be too much of either. Deanna caught up with her near the nurse's station at the 90-minute mark. "People are talking," Deanna said, because Deanna processed things by stating them directly. "About what happened in Trauma Bay. About you." "I know." "Price is telling it like you came in and disrupted the whole assessment, like you were grandstanding." Rachel looked at her monitor screen. "And Ferris?" Deanna was quiet for a second. "Ferris isn't saying much, but she's also not agreeing with Price." "That's something." "Rachel," Deanna lowered her voice. "What was that phrase you said to him? The thing that made him stop moving?" The shift in topic was so precise and so direct that Rachel almost smiled. She'd known Deanna for 18 months and had always appreciated that she didn't pace around questions she actually wanted answered. "Something from a long time ago," Rachel said. "The patient knew you." "Yes." "From before here." "Yes." Deanna waited. When nothing else came, she said, "Okay," in a tone that meant she had approximately 40 more questions, and had decided, for now, to hold them. She was a good friend that way, even if Rachel had never specifically allowed the friendship to be named. The OR status update came through the floor system at 11:42 p.m. Surgery complete. Patient in recovery. Stable. Rachel finished her chart entry, capped her pen, and stood up. She wasn't supposed to go to recovery. She had no official reason to be there, no assignment that covered it, and the incident report Holloway had filed meant that any additional contact with the patient would be noticed and logged. She went anyway, because there were things she needed to know, and the only person who could tell her them was coming out of anesthesia in a room at the end of the surgical wing. The recovery nurse, a man named Gary who'd worked nights at Callaway for 11 years, gave her a look when she came in but didn't challenge her. He'd seen stranger things. Voss was awake, or something close to awake, the specific half-consciousness of someone surfacing from general anesthesia who was still deciding which direction to swim. His color was better than it had been. The monitors showed numbers that Rachel read automatically and found adequate. He'd lost a significant amount of blood and his pressure was still being supported, but he was alive, which 90 minutes ago had not been guaranteed. She pulled a chair up and sat. "You're still here," he said. His voice was wrecked from the intubation, rough and slow. "You keep saying that like it's surprising." A sound that was almost a laugh. "How'd it go?" "You're alive," she said. "So, better than the alternative." He was quiet for a moment. His eyes tracked to the ceiling and back to her. "They're going to be here in the morning." She didn't ask who. She already knew who. She'd known since Sandra said government area code. "I didn't ask you to call anyone," she said. "No." He shifted slightly against the pillow, winced. "I called because of the mission, not because of tonight. I've been trying to reach someone for 6 weeks. The discharge paperwork on Black Horizon has been reopened. There's a review." He looked at her directly. They found something in the after-action records, about what happened, about Terrence. The name landed in the room like a weight dropped from a height. Rachel's face didn't change, but something in her posture shifted, a slight tightening along the line of her shoulders that she controlled before it could become visible. "Don't," she said quietly. "It wasn't Daniel." Her voice was not hard, but it was final. "Not tonight. You're post-op. Your pressure is being actively managed, and I need you to rest." "Rachel, not tonight." He looked at her for a long moment. Then he closed his eyes. "He was my teammate," he said, to the ceiling, "and you were the best medic I ever worked with. I'm not going to just not say that." Rachel was quiet. The monitor beside him beeped in its steady, even rhythm. Gary was doing something at the far end of the room, deliberately giving them space, which she appreciated. "Get some sleep," she said. "Deal with whatever comes tomorrow." She sat with him until his breathing evened out into genuine sleep. Then she stood, straightened the blanket that didn't need straightening, and left. The incident report was waiting on her digital record when she got to the staff lounge at the end of her shift. She read it standing up, still in her scrubs, one hand wrapped around a cup of coffee that had gone cold. It was thorough. Holloway wrote the way he practiced medicine, with a kind of precise confidence that didn't leave much room for alternate interpretations. The report cited her interference with a physician's direct assessment, her physical positioning between a resident and the patient, and what he characterized as repeated unsolicited input that disrupted the trauma team's workflow. He'd cited the specific moments. He'd been accurate about the sequence. He'd been carefully, deliberately inaccurate about the outcomes. No mention of the decompression correction, no reference to the retroperitoneal bleed she'd identified. Just the disruptions, clean and damning in isolation. It was a good document, as these things went. It would look thorough and professional to anyone who didn't know what had been left out. She set down the coffee cup and photographed every page on her personal phone. Then she sent a message to Sandra asking for a scheduled HR meeting and flagged it as urgent. She was not going to let the story be set without her in it. On her way out, she passed Dr. Ferris in the corridor. Ferris was still in scrubs, end of shift tired, with the particular look of someone who'd had a significant night and was still processing it. She stopped when she saw Rachel. "He's stable," Rachel said. "Post-op, in recovery." "I know. I checked." Ferris hesitated. She had a careful quality that wasn't timidity. It was the kind of caution that came from being genuinely thoughtful and from understanding that words had weight. I told the truth. To Sandra. About what happened. Rachel waited. The decompression assessment, the bleed. I told her you identified both of them correctly, ahead of the team. She paused. I also told her I'm going to say the same thing to HR if they ask. You don't have to do that, Rachel said. I know. She met Rachel's eyes. I know I don't have to. I'm doing it because it's accurate and because… A short pause. Because I don't want to be the kind of doctor who lets something like that slide. Rachel looked at her. Ferris was maybe 26, 27. She still had the slightly raw quality of someone who hasn't been worn down yet, whose principles are still in contact with their actual behavior. Thank you, Rachel said. She meant it, though the words felt insufficient for what Ferris was risking by saying it out loud on record. Ferris nodded once and kept walking. Nod. Rachel slept 4 hours, which was usually enough. She woke at 6:15 a.m. and lay in the dim of her apartment for a moment, listening to the sound of the city outside her window. She lived 12 minutes from the hospital in an apartment that contained her furniture, her clothes, her kitchen, and almost nothing that revealed anything about who she was before Callaway Regional Medical Center. No photographs from before. No memorabilia. One shelf of books, mostly procedural medical texts, and a handful of worn paperbacks. The walls were painted the color they'd been when she moved in. She'd furnished this place like someone who was renting temporarily, even though she'd been here 22 months. She got up, made coffee, and stood at the window while it brewed. She thought about Terrence Mallow. She thought about the way Voss had said the name in that recovery room, careful and weighted, like he understood exactly what it cost her to hear it. She thought about the review, about open discharge paperwork, about whatever they'd found in the after-action records. She'd spent 2 years building a life that was narrow enough to manage. One hospital, one floor, the work in front of her, nothing extraneous. No relationships that would require explanations. No history being dragged forward into the present. It was a small life by design, and she'd been getting by on it. She poured her coffee and sat at the kitchen table and acknowledged for the first time since the night before that that arrangement was probably over. She arrived at the hospital at 7:55 a.m., 40 minutes before her shift started, which was normal. What was not normal was the black SUV parked in the visitor lot with government plates and the 2 people in civilian clothes standing near the ER entrance who didn't look like they were there for medical reasons. She spotted them the same moment they spotted her. One was a woman, early 40s, short dark hair, jacket that fit a little too precisely. The other was a man, older, gray at the temples, with a bearing that was not quite military and not quite government, but something in between. The specific posture of someone accustomed to rooms where the stakes were high and the conversations were careful. They didn't approach her immediately. They watched her walk through the entrance, which she did at her normal pace, because running from people who were going to find her anyway was not a productive use of energy. She was changing into her second set of scrubs in the locker room when her phone rang. Number she didn't recognize. She answered. Rachel Darrow. It was a statement, not a question. The voice on the other end was measured and professional. My name is Major Elaine Whitford, Department of Defense Medical Operations Review. I understand you treated Sergeant First Class Daniel Voss last night. I'm one of several staff members who treated him, Rachel said. Yes. A pause. He's asked to see you this morning before we speak with him formally. I wanted to let you know we'll be on site today and that we'd like to speak with you as well, as part of a broader review. Rachel sat down on the bench in front of her locker. What kind of review? She said. The kind that involves sealed operational records and medical documentation from several years ago. Another pause. Deliberate, she thought, giving her time to process. I know this may feel sudden, but Sergeant Voss's medical situation last night accelerated a timeline that was already in motion. A beat. Rachel, I want you to know that you coming forward, or not, is voluntary. But what we've found is significant, and it directly involves you. The locker room was empty except for her. The fluorescent light above her hummed. I'll meet with you? Rachel said. Thank you. We'll be in the hospital administrator's conference room at 10 a.m. A brief pause. Get breakfast first. It's going to be a long conversation. The line ended. Rachel sat with the phone in her hand and looked at the floor. After a moment, she put the phone in her pocket and finished changing, because the shift started in 38 minutes and people still needed nurses regardless of what else was happening. She made it as far as the end of the corridor before Holloway stepped out of a doorway and blocked her path. He wasn't dramatic about it. He just appeared, which was its own kind of deliberate, and stood in a way that made it clear he'd been waiting. "You're early," he said. "I'm usually early," she said. He looked at her differently than he had the night before. The recalculation she'd seen beginning in his face during the surgery push had completed overnight, and what she saw now was the finished version, not the dismissal from before, not the surgical authority from the OR, but something harder and more calculated. He was looking at her the way he might look at a problem he needed to manage before it got in front of the people above him. "The DoD review team is here," he said. "I know. They've requested access to last night's patient records. That's their prerogative." He was quiet for a moment. The corridor was mostly empty at this hour, just a distant orderly with a cart and the ambient sound of the hospital waking up. She watched him arrange something in his expression, settling on an approach. "The incident report I filed last night," he said. "It was a documentation of events as they occurred. It wasn't personal." Rachel looked at him. "Okay. I want to make sure we're clear that my concern was with protocol. Not with your—" He paused, choosing. "Not with your capabilities." She recognized what this was. It was the overture of a man who had realized the ground had shifted and was trying to get out in front of it before someone else framed the story. He wasn't apologizing. He wasn't acknowledging that his assessment had been wrong. He was beginning the process of managing the situation, and he'd come to her first because she was the part of the situation he understood least. "Dr. Holloway," she said, "I'm going to my shift." "Rachel, I'm going to my shift," she said again, "and at 10 o'clock I'm going to speak with the review team, and at some point after that HR will schedule a meeting about your report, and all of those things are going to go the way they go." She held his gaze. "There's nothing either of us needs to say in this hallway right now." He stood there for a moment. Something moved through his expression that wasn't quite readable, not contrition, not anger, something in between that she suspected was what genuine discomfort looked like on a face that didn't show it often. She walked past him. He didn't follow. Room 214 had been given to Voss as a private recovery room, which was either hospital courtesy for a high-acuity post-op patient or someone's proactive decision based on the government plates in the parking lot. Rachel checked his chart outside the door, confirmed his overnight numbers had stayed adequate, then knocked and went in. He was more alert than she expected, still pale, still moving carefully to protect his left side, but sitting partially upright and with his eyes clear. The IV pole beside him held 2 bags. The monitor beside him was quiet, and someone had gotten him a cup of the hospital's aggressively mediocre coffee, which he was holding with the careful appreciation of a man who was very glad to be alive. "You look better," she said. "I feel like I got shot, and then a surgeon went looking for his keys inside my abdomen," he said. "So, relatively speaking." She checked the IV sites, glanced at his incision dressing, confirmed his breath sounds on both sides before she was even fully conscious of doing it. He let her, watching her work with an expression she didn't examine too closely. "Whitford called you," he said. It wasn't a question. "An hour ago." "She's good," he said. "Straight. She'll tell you what she actually found, not a filtered version." Rachel set her stethoscope back around her neck. "What did they find, Daniel?" He was quiet for a moment. He turned the coffee cup in his hands, one slow rotation. "The mission parameters for Black Horizon were altered after the fact," he said. "The timeline in the official record was changed. There's a discrepancy of 11 minutes between the original operational log and the filed after-action report." Rachel went still. "Terrence," she said, "died in a window that the altered timeline puts on you." He looked at her directly. "The original window, the real one, puts it on a command decision made 40 minutes before the breach, before you were even in position. He let that land. The medevac delay wasn't your assessment. It was an order. The order came from up the chain, it was buried in the paperwork, and the reason they buried it is because someone didn't want to explain why they held the bird for 40 minutes while a man was bleeding out. The monitors beeped. Somewhere down the hall, someone's cart rolled by. Rachel had spent 2 years carrying the specific weight of believing she'd been too slow, that she'd missed something, that if her assessment in that moment had been faster, sharper, better, Terrence Mallow would have made it home. She'd built her whole post-military life around that weight, around being the kind of person who didn't miss things, who caught what other people overlooked, who put herself in the path of being wrong so that she could be absolutely certain she wasn't. She'd been right all along. The things she'd been trying to atone for hadn't been her fault. She pressed her hands flat against her thighs. "Who knew?" she said. Her voice came out even, which she was grateful for. "At least 3 people in the command chain. Maybe more." He set down the coffee. "The review team has the original log. They have the names. That's what Whitford is here about." He watched her face. "Rachel, they want to give you your record back." She opened her mouth, closed it. "The fallen soldiers," she said. "Terrence, the others, part of the review." He nodded. "They're going to be properly documented. The honors that got buried are going to be opened." A pause. "It's not enough. I know it's not enough, but it's what we can do." She stood at the side of his bed and said nothing for a moment. Her jaw was tight. There were things she had learned to do with feelings that arrived larger than she had room for. She put them somewhere and dealt with them later, in private, which was a skill that had kept her functional for years, and was not particularly healthy, but had the advantage of working. She put this one somewhere and breathed. "I have a meeting at 10, she said. "I know." He reached out and briefly put his hand over hers on the bed rail. "Go deal with it." She nodded, stepped back, pulled her professional composure back around herself like a coat. She was at the door when he spoke again. "The nurses here," he said. "The ones who've been watching you get treated like you don't know anything. They're going to find out. Whatever Whitford has, it's not going to stay quiet." "I know," she said. "Holloway specifically." "I know, Daniel." A beat. "Okay," he said. She left. She made it halfway to the elevator before her phone buzzed with a message from Sandra. "HR is asking to move the meeting up. Holloway submitted an addendum to the report this morning. He's pushing for a formal review of your nursing credentials." She read it twice. Then she kept walking. The elevator doors opened. She stepped in. The addendum was escalation. He was moving to make the credential review happen before the DoD meeting could change the context of the conversation. He was smart enough to see the window closing and experienced enough to know that the best way to neutralize someone was to put their professional standing in question before they had a chance to establish their credibility with the people who mattered. She had approximately 2 hours and 40 minutes before the 10 a.m. meeting. She pulled up Sandra's contact and typed back, "Don't schedule HR before 10. Tell them I'll be available after. Don't explain why." She sent it and pocketed her phone. The elevator opened on her floor. She stepped out into the ordinary noise of the hospital morning. Call lights, medication carts, a patient's television too loud down the hall, and walked to the nurse's station to take her assignment. She had patience. She had a job. She was going to do it. At 9:57, she was going to walk into that conference room and sit down across from Major Elaine Whitford, and whatever was in those sealed files was going to come out into the room, and she was going to have to figure out, in real time, how to exist on the other side of the story she'd been carrying. But first, a patient in room 208 had a dressing that needed changing. A woman in 211 had been asking since 6 a.m. for someone to explain her discharge instructions in plain language. An elderly man in 204 had been awake most of the night and needed someone to sit with him for 5 minutes. Rachel picked up her assignment sheet and got to work. She was almost at room 208 when the overhead PA crackled, and what came through it was not a standard announcement. It was Sandra's voice, clipped and fast, with the specific controlled urgency of a charge nurse calling a code she's not ready for. "Nursing staff to room 214. Nursing staff to room 214. Rachel was already running before the announcement finished. She hit the door of room 214 at a run and understood immediately that this was not cardiac. Voss was conscious. That was the first thing. Conscious and sitting up straighter than someone 18 hours post-op had any right to be, which told her the problem wasn't physiological. The second thing she understood was that he wasn't alone. Two men in the room, not medical staff. One was the gray-templed man she'd clocked in the parking lot, now standing at the foot of the bed with his hands loose at his sides. Body language that was aggressively non-threatening in the specific way of someone who has been trained to look non-threatening. The other was younger, in a jacket too heavy for the season, standing near the window with a tablet in his hands and an expression that had gone flat and professional in a way that made the hair on Rachel's arms come up. Sandra was in the doorway behind her. They came in without checking at the nurse's station. I told them to wait for authorization, and the patient got... "It's fine," Voss said. His voice was tight. "Sandra, it's fine. I know these people." Sandra looked at Rachel. Rachel looked at the two men. "Why is the PA calling a nursing emergency?" Rachel said. "Because your charge nurse panicked," the gray-templed man said, not unkindly. "We're cleared to be here. The authorization just hadn't come through to this floor yet." "It still hasn't," Sandra said. "Sandra." Rachel kept her eyes on the two men. "Give me 5 minutes." A pause. Then Sandra left, pulling the door almost closed, and Rachel was in the room with Voss and the two men who hadn't introduced themselves. And the tension in the air had a specific quality she recognized. Not danger exactly, but weight. The kind that gathered in rooms where something was about to become official. "Rachel Darrow," the gray-templed man said. "My name is Warren Pruitt. I'm with the DOD Investigation Unit working under Major Whitford's review." He nodded toward the younger man. "This is my colleague. We know your meeting is at 10, but something came up this morning that changes the shape of that conversation, and we wanted Sergeant Voss to hear it at the same time you did." Rachel looked at Voss. He looked back at her with an expression she couldn't entirely read, somewhere between prepared and unsettled, which on his face was remarkable because she hadn't seen unsettled on him since he'd come through the ER doors. "What came up?" she said. Pruitt glanced at his colleague, who turned the tablet around. On the screen was a document, dense, formatted in the specific bureaucratic architecture of military after-action reports. Rachel had read enough of them in her life to parse the layout quickly. Mission designation at the top, operational log down the left margin, timestamps in precise increments. She could see where the text changed character partway down the page. Different density, slightly different formatting. Invisible to anyone who hadn't spent time with these documents, obvious to anyone who had. The original operational log for Black Horizon was recovered from a backup server 3 weeks ago, Pruitt said. We've had forensic analysts on it since. The alterations were systematic, not one person acting alone. 3 separate entries modified across 2 different time signatures. He paused. The medevac hold at 0214 was a direct order from Theater Command. It was in the original log. It was removed from the filed report. Rachel said nothing. The order was given for tactical reasons that are still classified, Pruitt continued. I can tell you that the reasons existed and that the decision was made above the pay grade of anyone in your unit, including you. He looked at her steadily. The assessment you made at 0214 was correct. The call you made was correct. What happened to Corporal Mallow was not a result of your actions. The room was very quiet. Voss was watching her. He wasn't saying anything, and she understood that he wasn't saying anything because there wasn't anything he could say that would make this easier, and he was smart enough to know that. She looked at the document on the tablet. She looked at the timestamp discrepancy. She looked at the 11-minute gap that had cost her 2 years of carrying a weight that belonged to someone else. Who ordered the hold, she said. That's still under review, Pruitt said. I'm not asking for a legal proceeding. I'm asking who. A pause. Lieutenant Colonel Darren Ashby. He retired in 2021. The review is examining whether criminal referral is appropriate. Voss exhaled slowly through his nose. There are 3 other members of the Black Horizon unit who've been interviewed, Pruitt continued. All of them said the same thing about your conduct during the mission. He hesitated, not from uncertainty, but from choosing his words with the care of someone who understood their weight. The phrase that was used in multiple interviews was exceptional under impossible conditions. Rachel pressed her back teeth together. What happens next? She said. That's partly what the 10 o'clock meeting is about. Your service record will be formally restored. The commendations that were put on hold pending the original investigation will be processed. He glanced at Voss briefly, and the fallen members of the unit will be properly documented with full honors. That process starts today, regardless of anything else. She nodded once, tight and controlled. Is there anything else? She said. One thing. Pruitt's voice shifted slightly. There are people at this hospital who are going to learn what's in these files. We can't control the flow of that information entirely. Major Whitford wanted you to know that before the meeting so you weren't walking in cold. Rachel looked at him. You mean Holloway? I mean anyone who has filed official documentation against you in the past 24 hours. He held her gaze. Because that documentation is going to look very different once your record is part of the public-facing review. The door opened behind her. She turned. Doctor. Gareth Holloway stood in the doorway. He wasn't in scrubs. He'd changed into his attending coat, which meant he'd been somewhere official or preparing to be. His eyes moved across the room in a single sweep. Pruitt, the younger man, the tablet, Voss, Rachel, and the calculation happened in his face faster than it should have, which meant he'd already known more than he'd shown. I was told there was an unauthorized access incident in this room, he said. His voice was steady, physician in charge steady. No unauthorized access, Pruitt said. Clearance came through on our end at 8:14. There was a delay in the floor notification, which has been resolved. Holloway's eyes moved to Rachel. They stayed there. Rachel, he said, you're not assigned to this room. I responded to a nursing call, she said. The call was a miscommunication. He took 2 steps into the room. He was doing the thing she'd seen him do before, occupying space by moving into it, the low-grade physical vocabulary of someone who didn't like situations he hadn't constructed. I think it would be best if you returned to your floor assignment. Nobody else in the room moved. Pruitt watched the exchange with an expression that had gone careful and attentive. Voss said from the bed, in a voice still rough from surgery and entirely steady, She stays. Mr. Voss, Sergeant First Class Voss, Voss said. Not aggressively, just factually. And I said she stays. Holloway looked at him, looked at Pruitt, looked at the tablet, which was still facing outward, the document visible to anyone in the room who could read a military after-action report. His face changed. It was small, a micro-adjustment around the eyes, a fractional tightening of the jaw. But Rachel had been reading faces professionally for years, and she saw it clearly. He was looking at this document on that tablet and understanding, in the specific way that intelligent people understood things when the evidence was right in front of them, that the shape of what was happening in this room was not what he'd built his incident report around. I see, he said, quietly. The 10 o'clock meeting, Pruitt said, addressing Holloway directly for the first time, will include a review of events from last night's trauma case. We'd ask that all relevant staff make themselves available. Of course, Holloway said. His voice had changed. Still controlled, still professional, but with a hollowness underneath it that Rachel recognized as a man hearing the sound of something he built beginning to come apart. I'll be available. He looked at Rachel one more time. She met his eyes and said nothing, because she didn't need to say anything, because the document on that tablet and the 2 DOD investigators in the room and the patient in the bed who had just formally invoked his rank in front of a witness were already saying everything. Holloway left. The room held its silence for 3 seconds. Then Voss said, very quietly, Rachel. She turned to look at him. His face had lost the controlled professional mask. Not completely, not dramatically, but enough. He looked tired and post-surgical, and like someone who had been carrying his own version of 2 years of weight and was feeling, for the first time, the specific exhaustion of something you've been pushing against finally beginning to give. Sit down, he said. For 5 minutes. Just sit down. She looked at the chair beside his bed. She looked at Pruitt, who was making a deliberate show of reviewing something on his own phone, giving her the privacy of his inattention. She sat down, and in the corridor outside room 214, barely audible through the almost closed door, she could hear the sound of Holloway's footsteps moving away, slower than they'd arrived, and for the first time since she'd met him, without the weight of certainty underneath them. Her phone buzzed in her pocket. She pulled it out. A message from a number she didn't recognize, local area code, sent 40 seconds ago. This is Mara Pendleton, Callaway Regional Hospital Administrator. I've been asked to inform you that your meeting has been moved up. Conference room is ready now. Please come immediately. Dr. Holloway has also been asked to attend. There is a third party present you should be aware of. Rachel stared at the message. What is it? Voss asked. She showed him the screen. He read it. His jaw tightened slightly. What third party? He said. I don't know. She was already standing. She looked at Pruitt. Did you know about this? Pruitt looked up from his phone. His expression was controlled in the specific way of someone managing information carefully. Major Whitford may have made some additional arrangements this morning, he said. I'd recommend going down. Rachel looked at him for a moment. Then she looked at Voss. I'll come back, she said. I know you will, he said. She left the room at a walk that was almost but not quite a run, and she was halfway to the elevator when she heard it. Voices from the direction of the main entrance, more than one, moving with the coordinated efficiency of people who had a purpose and a destination and were not slowing down for the layout of the building. She stopped. At the far end of the corridor, coming through the main entrance doors with a hospital administrator she recognized as Mara Pendleton walking quickly beside them, were 4 people in uniform. Not DOD civilian, not investigators, military, full dress. Rachel stood in the middle of the corridor and watched them come, and she understood, in the way you understood things that arrived after a long time of waiting, that whatever she had been preparing herself for in that conference room, whatever careful, controlled, documented process she had steeled herself to sit through, was not what was about to happen. One of the uniformed figures looked up and found her across the length of the corridor, and stopped walking. The uniformed figure who had stopped was a woman. Colonel's insignia on her shoulders, late 50s, haircut close at the sides, standing with the kind of stillness that came from decades of choosing exactly when to move and when not to. She looked at Rachel across the length of the corridor with the expression of someone who had been expecting this moment for longer than Rachel had. Rachel didn't move either. The administrator, Mara Pendleton, whom Rachel had spoken to exactly twice in 2 years, both times about paperwork, was visibly out of her depth in the specific way of someone managing a situation whose dimensions kept expanding. She was keeping pace with the uniformed group and trying to look like she'd anticipated all of this, which she clearly hadn't. The colonel started walking again. The others followed. They covered the corridor length in 15 seconds, and when they stopped, the woman was close enough that Rachel could read her name tape. Hargrove. Darrow, she said. Her voice was direct and unhurried. Not a question, not a greeting. Just the confirmation of someone locating a person they'd been looking for. Yes, Rachel said. Colonel Patricia Hargrove, Special Operations Medical Command. I've been on a plane since 4 this morning. She looked at Rachel with the particular attention of someone doing a rapid and experienced assessment, not medical, something more like recognition. You look tired. I worked a night shift, Rachel said. I know. The colonel glanced at Pendleton briefly. We're going to need a room, not the conference room, somewhere with less foot traffic. Pendleton blinked. We have the administrator's, something smaller, Hargrove said. And I need Sergeant Voss's attending physician present, not as a decision maker, as a witness. A beat. That would be Dr. Holloway, Pendleton said. Hargrove looked at Rachel. The look was brief and precise and communicated, without words, that she was already aware of exactly who Dr. Holloway was and what he'd done. Fine, the colonel said. Get him. They ended up in a consultation room off the second-floor surgical wing. 8 chairs, a table, a whiteboard. No one had cleaned since a planning session that appeared to have involved a lot of flowcharts. The 4 uniformed figures arranged themselves without being directed to, the way people did when they'd spent years in rooms together. Major Whitford, whom Rachel recognized from the parking lot that morning, came in last and closed the door. Holloway arrived 4 minutes later. He'd taken the time to button his coat fully and straighten it, which told Rachel something about how he'd spent those 4 minutes. He came in composed, assessed the room in one practice sweep, and sat in the chair Pendleton indicated without showing anything on his face. But she watched his eyes move across the uniforms, across the insignia, across Whitford's rank, and she saw the moment he understood that whatever he'd thought this meeting was, it was not that. Hargrove didn't preamble. "I'm going to be direct," she said, "because I have limited time, and there are things that need to be said in front of witnesses before they go into the formal record." She opened a folder on the table in front of her. Rachel could see documents, dense, multi-page, stamped with the kind of classification markers that had been part of her life once, and that she hadn't seen up close in 2 years. Sergeant First Class Daniel Voss was injured during an off-post incident involving active surveillance related to the Black Horizon Review. His presence in this hospital is not incidental to what I'm about to say. She looked at Rachel. Rachel Darrow served as combat medic with the unit designated Task Force Arden during Operation Black Horizon. She was discharged 18 months after the mission under circumstances that the current review has determined were based on falsified operational documentation. A pause. "I want to be specific. The documentation that led to her separation from service was altered by parties who had a vested interest in assigning responsibility for the death of Corporal Terrence Mallow to someone with no command authority to push back." She held Rachel's gaze. She was the easiest target. She was junior, she was not in a position to challenge the record, and the people who made the decision to hold the medevac at 0214 needed someone to absorb the weight of that. The room was completely silent. Holloway hadn't moved. His hands were flat on the table. Rachel watched him without appearing to watch him and saw, in his stillness, the particular quality of a man confronted with context that rearranges everything he thought he understood about the situation he's in. "What does this mean formally?" Pendleton said. Her voice was careful. "It means that Rachel Darrow's service record is being restored, effective immediately, with full commendations. It means that the separation documentation will be voided and replaced." Hargrove turned a page. "It also means that the investigation will become public record at some point in the next 30 to 60 days, which means anyone with documentation that frames Rachel Darrow as professionally deficient will want to revisit that documentation before it's sitting next to a DOD record that says the opposite." She said it evenly, without inflection. She did not look at Holloway when she said it. He looked at her anyway. "Is there something you'd like to add, Dr. Holloway?" Whitford said. She'd been quiet until this moment, sitting at the end of the table with a tablet in front of her, and the attentiveness of someone recording the temperature of every person in the room. A pause. "No," Holloway said. "You filed an incident report last night citing Rachel Darrow for insubordination and scope of practice violation," Whitford said. "Not a question. That's standard documentation procedure for... You also filed an addendum this morning requesting a formal review of her nursing credentials." A longer pause. "I filed documentation reflecting my assessment of events," Holloway said. His voice was controlled. Whatever he was feeling, he was managing it, which Rachel grudgingly acknowledged took a certain kind of discipline even when it was the wrong response. "Your assessment of events." Whitford nodded slowly. Dr. Ferris's statement, which she provided this morning, indicates that Rachel correctly identified a tension pneumothorax on the wrong side from the team's initial assessment, and subsequently identified a retroperitoneal bleed that prevented the patient from going into cardiac arrest. She looked at him. "Is that your recollection of events?" The silence stretched 3 full seconds. "The team assessment was collaborative," Holloway said. Rachel said nothing. She kept her hands still on the table and her expression neutral and let the silence work, because silence in rooms like this was not empty. It had weight, and right now its weight was landing on Holloway. "Rachel," Hargrove said, "I want to give you the opportunity to say anything you want to say, on record, about last night or about anything else." Rachel looked at her, looked at the folder of documents, looked briefly at Holloway. She thought about what she wanted to say and whether she wanted to say it in this room, in front of these people, with Holloway sitting 8 feet away. She decided she did. "The patient would have died," she said, "if the initial assessment had proceeded. He would have died from a treatable injury because the pressure presentation was unusual and nobody in the trauma bay had seen that specific ballistic pattern before." She paused. "I have. I identified it in the field under worse conditions. And when I said something, I was told to step back. She kept her voice level. I stepped back as far as I could while someone I believed was about to be killed by the wrong intervention was in front of me. And then I stopped stepping back. Nobody spoke. That's my statement, she said. Hargrove looked at her for a moment, then she nodded once, and Rachel recognized the nod. Not agreement specifically, but a deeper acknowledgement, the kind that passed between people who had been in difficult situations and understood what it cost to hold a line. The meeting ended 35 minutes later. Rachel came out into the corridor and stood for a moment, letting the noise of the hospital settle back around her. Normal hospital sounds, carts, monitors, overhead pages, the particular ambient frequency of a building full of people who needed things. She'd spent 2 years using that noise as a kind of insulation, a thing to be present inside so that the silence inside her own head had somewhere to go. It felt different now. She wasn't sure how yet. Pendleton appeared beside her. The formal letter of apology from the hospital will be drafted today, she said. She sounded like someone executing a checklist under pressure. Human Resources has been notified that the credential review request has been withdrawn. We'll want to schedule a time to sit down with you about— Not today, Rachel said. Pendleton blinked. Of course, whenever you're— I have patience, Rachel said. I'm going back to my floor. She walked away before Pendleton could attach anything further to the conversation. She passed Holloway in the stairwell. She hadn't planned to. She'd taken the stairs because the elevator had a wait, and apparently he'd had the same thought. He was 1 floor below her, heading down, and he heard her footsteps and looked up. They were alone in the stairwell. Concrete walls, fluorescent lights, the fire door handle cold and institutional between them. He stopped. She kept walking down until she was on the same landing. Up close, he looked older than he had last night. It wasn't physical. He'd slept, changed his coat. He was physically the same man. It was something happening behind his eyes, the specific aging that occurred when someone who had organized their professional life around a particular self-concept started to feel the foundation of that concept coming loose. She didn't feel satisfaction at it, which surprised her a little. She felt tired and clear. The addendum, he said. His voice was quiet, the sound of it absorbed by the concrete stairwell. I'm going to formally withdraw it. I know, she said. Whitford already has it in her notes. He looked at her. What I filed last night, the original report, should stay, Rachel said. He stopped. It happened, she said. The sequence of events is accurate, even if the framing is wrong. Let it stay in the record and put a correction beside it. That's what records are for. She looked at him directly. People should be able to see what happened. His jaw moved once. I made an error in assessment, he said. Not easily. The words came from somewhere that cost him something. She could hear it. Yes, she said. You did. She waited to see if he had anything else. He didn't, or if he did, he couldn't find the shape of it. She walked past him and down the stairs and out through the fire door into the second-floor corridor, and she didn't look back. The floor was busy the way it always was at mid-morning, the particular churn of a shift that had been going for hours and still had hours left. Medications, assessments, 2 discharges, a patient in 208 who'd developed a fever and needed a workup. Rachel moved through it with the specific efficiency of someone who had separated the weight of the last 3 hours from the work of the present moment, which she was good at and which was one of those things that looked like emotional compartmentalization but was really just competence. Deanna caught her between rooms. You went to the second floor, she said, with the military people. Yes. People are talking. Price is saying— Price can say whatever he wants, Rachel said. Room 208 has a fever. Did someone order cultures? Deanna stared at her. Rachel. Deanna, the fever. I ordered cultures at 9:45. They're pending. She lowered her voice. What happened in there? Rachel stopped. She looked at Deanna, who had covered her assignments twice without being asked, who had carried concern for her in a way that hadn't required acknowledgement, who had asked her quiet questions and accepted partial answers with the patience of someone who understood that people had their reasons. A lot, Rachel said. I'll tell you later, when I have words for it. Deanna studied her face. Then she nodded. "The guy in 214, she said. "He's been asking about you." "I'll go after I check 208. She went. The fever in 208 turned out to be a wound infection beginning to declare itself, which she flagged, documented, and got ahead of before it became a problem. It took 40 minutes and required her to be fairly pointed with the covering resident about the antibiotic selection, which she did without drama and which the resident, to their credit, received without the kind of territorial friction she'd learned to expect. Things were different on the floor today. She couldn't have said exactly how. No single interaction was dramatically altered, but the texture of things had shifted. The nursing staff who'd been watching her sideways since last night were watching her differently now. Not with the tentative distance of people reassessing someone they'd already categorized, but with something more open. Ferris had stopped by the nurse's station and spoken to her directly, without the careful professional buffer she'd maintained before. Even Gary from recovery had come up to offer what was essentially, in hospital staff terms, a significant gesture of acknowledgement. He'd brought her a coffee from the good machine on the third floor, set it on the counter near her charting station, and said nothing whatsoever. She drank it while she updated 208's chart. She didn't let herself look too closely at any of it, because she was still in the middle of a shift and the work didn't stop for anything, and because she had a particular wariness around moments that felt like they might require her to respond with more softness than she currently had access to. Room 214 was quieter than it had been that morning. Voss was sitting up at about 60 degrees, which was the maximum his abdomen would comfortably allow at this point, with his color better and his monitors showing a picture that was moving steadily in the right direction. The government area code contacts had been and gone. The room had the particular stillness of a space that had held a lot of activity and was now being left to settle. He watched her check his vitals and dressing with the patient attention of someone who no longer needed to monitor for errors. "Hargrove," he said. "She was here," Rachel confirmed. "How'd it go?" "It went." She checked the incision edge, confirmed the drainage was appropriate, replaced the dressing with movements that were efficient and careful and required enough concentration that she could keep her face neutral while she did it. "Your numbers are good. You're a day ahead of where I expected." "Rachel." She finished with the dressing and straightened. He was looking at her with the expression he'd worn in the recovery room, the one she'd decided not to examine too closely, the one that understood too many things about her. "He was my friend too," he said. "Terrence." Her throat tightened. She pressed it down. "I know," she said. "I've been carrying it as well, just differently." He paused. "I knew you took the weight of it. I should have pushed harder on the review years ago, and I didn't because I was—" He stopped. Tried again. "I kept telling myself the system would correct it, that someone else would catch it." He shook his head slightly. "I let you carry something I should have helped you put down." She looked at him. At the particular self-accusation in his face, the specific form of guilt that came from good people who hadn't done quite enough in time. "You're here now," she said. He was quiet for a moment. "Is that enough?" "I don't know yet," she said honestly. "But it's what there is." He nodded slowly. It wasn't the answer that absolved him, and he seemed to understand that, and to accept it with the gravity it deserved rather than looking for her to soften it. She sat down in the chair. For a minute, maybe two, neither of them said anything. The monitor beeped at its steady interval. Outside the room, the hospital made its ordinary sounds. "What happens now?" he said. "For you? A week inpatient minimum, then a long recovery. You pushed too hard this morning. Your pressure dropped twice and your resident is already annoyed about it." "For you?" She considered the question. The hospital wants to meet about redesigning the trauma training program. Pendleton mentioned it this morning in the way people mention things when they're trying to communicate that they understand they owe you something but haven't decided exactly how much. And the military record. Hargrove is handling the paperwork. She looked at her hands. "I don't know what it means practically yet. I'm still figuring that out." "Does it change anything about being here?" She looked up at him. "It changes what I know about why I'm here," she said. "Whether I built this in the right place or just the available place, I don't know. I need time with it." He nodded, didn't push. She stood, smoothed the front of her scrubs. Rest, she said. Actual rest. I'll check again at 3. She was at the door when his voice came, quiet. You were the best we ever had. I need you to know that I believe that, not because Hargrove said it in a room, because I was there. She kept her hand on the doorframe. I know, she said. I'm working on believing it myself. She left. At 1:15 p.m., Holloway appeared at the trauma bay entrance during a routine assessment, not for Rachel. He was there for a clinical reason, a returning patient he'd treated previously. She was aware of him the way she was aware of most things on her floor, peripherally and continuously, without dedicating specific attention to it. She watched him work. He was technically excellent. She'd never doubted that and didn't now. His hands were sure, his assessment was methodical. He moved through the protocol with a speed that was appropriate and not reckless. He was good at the part of medicine that happened in the body. The resident he was working with, a second-year named Tomas, she hadn't interacted with much, was watching him with the slightly corrected attentiveness of someone who'd spent the morning absorbing secondhand information and was reassessing his model of the room's hierarchy. The nursing staff were doing the same thing. She could feel the adjustments happening in how people moved around Holloway, the subtle shifts in deference that had been automatic and were now tentative, waiting to see which way things settled. Holloway felt it too. She was certain of that. He finished the assessment, gave clear and adequate instructions to Tomas, and left. He did not look at Rachel on the way out. She went back to her patient. At 2:30 p.m., Sandra called her into the charge station. HR confirmed, Sandra said. The credential review request has been officially withdrawn. The incident report remains in the file with an attached administrative notation that the assessment context is under review. She paused. Pendleton's office called. They want to know your availability next week for a preliminary conversation about the trauma training initiative. Tuesday, Rachel said. I'll tell them. Sandra looked at her over the top of her reading glasses. You're handling this very calmly. I'm at work. You're always at work. Rachel said nothing. There are people here who owe you an apology, Sandra said. Not just Holloway. Some of the nursing staff made assumptions. I made assumptions early on that I should account for. Rachel looked at her. Sandra was 61, a 20-year ER veteran, the kind of nurse who had seen enough to be appropriately humble about what she didn't know. She was offering something genuine, which was the only kind of offering Rachel had ever had patience for. I know, Rachel said. I'm not keeping a ledger. Maybe you should, Sandra said. Maybe, but it's a lot to carry. She paused. Some of those assumptions, I helped build them. I kept my head down. I didn't correct people when they got it wrong. She thought about that. I'm not sure yet whether that was protective or just avoidance. Sandra took off her glasses. Probably both. Probably, Rachel said. The PA crackled. A standard overhead page, nothing urgent. They both waited for it to resolve. You're a very good nurse, Sandra said when it was quiet again. I don't mean that as a consolation. I mean that separately from everything else. You're very good at the work. Thank you, Rachel said. She meant it. But she was coming out of 211 at 4:20 p.m. when she almost walked into Dr. Price. He stopped. She stopped. The corridor was busy enough that they were briefly forced to step to one side to let a medication cart pass, which gave the encounter an involuntary intimacy. Price was 28, tall, had the particular confidence of someone who'd moved through medicine at the top of his class and still lived mostly inside that fact. He'd spent the past 2 years looking at Rachel in the specific way that people looked at colleagues they'd decided were below them. Not actively hostile, just through. He looked at her differently now, not with contrition. He wasn't quite there yet, or possibly wasn't wired for it in a way that would look that clean. But the looking through had stopped, replaced by something more uncomfortable and less resolved, which was its own kind of recognition. The Black Horizon documentation, he said. I heard about it from Ferris. Okay, Rachel said. I'm not good at... He stopped. Started again. Last night, the decompression. I was wrong. She waited. I should have listened. He said it with the difficulty of a man who was performing an act that didn't come naturally and knew it, and was doing it anyway. Earlier, when you flagged the presentation, Yes, she said. He blinked, appeared to have expected more. I'll be more careful, he said. Good, she said. That's good. She started to move past him. Price, the other thing, the story you were telling this morning about last night, the grandstanding version. He went still. It's going to matter, she said, what version you keep telling. Not because anyone's tracking you, but because you're going to be a physician for 30 more years, and the habits you build right now about how you process being wrong are going to shape every room you're in for all of it. She paused. That's all. She walked away. Behind her, she heard nothing, which meant he was standing there with it, and whether that was useful or not was genuinely not something she could control. At 5:50 p.m., 10 minutes before the end of her shift, her phone rang. Sandra's extension. Room 214, Sandra said. Holloway's there. Rachel was already moving. For what? He requested to speak with the patient privately. A pause. Voss said to call you. She covered the distance in under 2 minutes and knocked once before pushing the door open. Holloway was standing at the foot of the bed, not in a physician at the patient position, not assessing, not in charge, just standing. It was an unusual posture for him, and Rachel understood as she came in that he'd put himself there deliberately, in a position that had no authority attached to it. Voss was watching him with the alert neutrality of someone who was allowing a situation to develop without pre-deciding the outcome. Neither of them had been speaking when she entered. Holloway looked at her. I'm not here clinically, he said. She waited. He turned back to Voss. A beat passed in which he appeared to be locating words he hadn't used recently. Last night, he said, your nurse was correct. My team's assessment was wrong. I proceeded with an intervention that would have caused significant harm. He paused. I filed a correction to the incident report that reflects the accurate clinical sequence. Voss said nothing. I understand that you intend to have last night documented accurately, Holloway continued. I'm not here to ask you not to. I'm here to tell you that I don't intend to obstruct that. He looked at his hands briefly, then back up. I've been in this hospital for 16 years. He stopped. I've developed habits about who I take seriously and who I don't, and those habits aren't based on what I'm looking at. They're based on other things. He said it with the specificity of a man identifying a genuine problem rather than offering a general mea culpa. I was wrong. About Rachel. And the clinical outcome for your patient last night is the consequence of that. The room was quiet. Voss looked at him for a long moment. I appreciate you saying it, he said. To her face, that's where it matters. Holloway turned to Rachel. She held his gaze. She thought about what she wanted from this moment, whether she wanted contrition, whether she wanted him to understand the scale of what his habits had cost her in the past 2 years, whether she wanted him to feel the weight of the incident report and the addendum and the 16 years of people like him looking through people like her. She wanted those things, and she was also 24 hours into a shift that had rearranged the architecture of her life, and she was exhausted in a way that went past sleep, and she did not have the energy to carry his guilt on top of her own if she let herself sink into this. Okay, she said. Holloway's expression moved slightly. That's it? He said. I don't know what else you're expecting, she said honestly. The documentation is accurate now. The record is what it is. Whatever happens next at this hospital is going to happen. She paused. I'm not going to tell you you're forgiven because that's not something I can actually give you, and I won't pretend otherwise. He absorbed that. Fair, he said quietly. He left without looking at either of them again. The door swung closed. Voss exhaled slowly. How are you doing? Honestly? She sat down. I have no idea. I've been moving since 6 this morning, and I'm running on the momentum of that. She rubbed the back of her neck. Ask me tomorrow. Tomorrow, he said, there's supposed to be someone here from the official records office to process the restoration paperwork. I know. You should bring someone with you, not Pruitt or Whitford, someone from your life, someone who knows you now. He paused. You have people like that? She thought of Deanna, of Sandra, of Gary and his coffee from the good machine. More than I thought, she said. He nodded. She stood, straightened, checked his IV one final time in the automatic way of someone for whom caring for the people around her was so deeply habituated it happened without decision. She was at the door when his voice came again. "Rachel, one more thing." She turned. He was holding his phone. The screen was facing her. On it was an email, still open. The sender line showed a name she didn't recognize. A general's name, 3 stars, a command address she'd last seen years ago. The subject line said, Black Horizon Review, Sport, Final Disposition. She stepped back into the room. Read the email. It was 3 paragraphs. She read it twice. When she looked up, her face had done something she couldn't fully control for the first time since the night before. "They found the 4th person," she said. "Sent an hour ago," Voss said. "The command chain for the medevac hold, the 4th signature on the hold order." He watched her face. "It's someone you know." Her hands were cold. "Who?" she said. He told her. And the name that came out of his mouth was not a name from years ago, not a figure from the buried history of Black Horizon. It was a name she had heard in this building, in the past 48 hours, spoken in administrative corridors and on official documentation, and in a conference room where she'd sat across a table and assumed, because everyone in the room had assumed, that the person on the other side of it was on her side. The name was Warren Pruitt. She stood in the middle of room 214 and held that fact up against everything she knew about the past 12 hours. The careful professionalism, the measured delivery of information, the way he'd managed the morning's conversations with the precision of someone who knew exactly which pieces to move and in which order. The way he'd been in this room when she arrived. The way he'd positioned himself as the person bringing her truth. "He's DOD," she said. Her voice came out flat. "He's part of the review team." "He was part of the original command structure," Voss said. "He moved into DOD oversight 18 months ago. The review was assigned to his unit." He held the phone steady so she could see the email again. The 4th signature on the hold order, the one they couldn't locate in the initial document recovery. It came out of a backup archive 3 hours ago. His name is on it. She read it again. The general's email was precise and bureaucratic and left no room for interpretation. Warren Pruitt had countersigned the order that held the medevac at 0214. He had then, 18 months ago, positioned himself inside the oversight unit reviewing the very event he'd helped cause. He had managed the narrative from the inside, controlling what surfaced and what didn't, for long enough that it almost worked. It had almost worked. "He told me things this morning," she said. "Specific things, about the review findings." "I know," Voss said. "The question is what he told you and what he left out." She thought back through the conversation in his room, the careful sequencing of information. What Pruitt had confirmed, what he'd attributed to Whitford, what he'd said was still under review, the way he'd named Ashby as the order's origin, a partial truth, specific enough to feel complete. Ashby's name was real. Ashby had signed the order. But Ashby wasn't the only one. Pruitt had handed her one signature and kept the other in his pocket. "Does Whitford know?" she said. "The email CCs her, so she knows now." He paused. "She's probably already moving." Rachel looked at the phone one more time, then handed it back. Her mind had the specific quality it got when she was working. Clear, fast, sequential, the noise of everything else dropping away because there was a problem in front of her that required her full attention. "I need to find her," she said. "Rachel." His voice was careful. "You're not... This isn't... I know what it is and what it isn't," she said. "But I was in a room with him this morning being told the shape of something and the shape was wrong. And I need to know what the real shape is before it goes into any official record with my name on it." He didn't argue. She left. Major Elaine Whitford was not in the conference room, not in the administrator's office, and not at the nurse's station where someone had last seen a woman in uniform 20 minutes ago. Rachel found her in the stairwell, the same stairwell where she'd passed Holloway that morning, concrete and fluorescent and weirdly private, standing with her phone pressed to her ear and her jaw tight. Whitford looked up when Rachel pushed through the fire door. She held up one finger. "Wait," and finished the call in 4 sentences that Rachel couldn't hear clearly, but whose tone she understood completely. Then she lowered the phone. "You know," Whitford said, "Voss got the email." Whitford exhaled through her nose. It was the controlled exhale of someone who was furious and was managing it, which Rachel recognized and respected. "We found the archive record 45 minutes ago. I've been on the phone with the Inspector General's office since." She looked at Rachel directly. "Everything I told you this morning was accurate based on what I had. I want you to know that." "I know," Rachel said. "He gave you what he could afford to give you. He gave me Ashby because Ashby was already traceable. The second signature was in a separate log, different classification tier. He knew we'd get there eventually. He was buying time." She shook her head once, tight and disgusted. "He's been in my unit for 18 months, running interference on his own file." Rachel leaned against the wall. The concrete was cold through her scrubs. "What happens now?" she said. "He's being detained by the IG team. It's already in motion." Whitford's voice was precise and fast. "His access to all Black Horizon documentation has been revoked. Everything he touched in the past 18 months is being reviewed for interference." A pause. "The original findings still stand. The restoration of your record, the commendations, the honors for the fallen. None of that changes. What changes is the full accounting of who made the decision at 0214. "Ashby and Pruitt," Rachel said. "Ashby and Pruitt," Whitford confirmed. "Both names will be in the public record when the review closes." Rachel was quiet for a moment. She thought about what it meant to spend years inside a story that someone else had written about you, a story designed to make you carry weight that belonged to someone who had more to lose than you did, someone who had calculated that you were the path of least resistance. She thought about Pruitt's face that morning, so carefully calibrated, so professionally warm, and how close she'd come to leaving that room believing she had the whole picture. She was glad Voss had gotten the email. She was glad she'd come back into that room. She was glad, she realized, for a lot of things she'd spent 2 years not being glad for. "The paperwork tomorrow," she said. "The record restoration. That still happens." 8 a.m., Whitford said. "I'll be there personally." Rachel nodded. She pushed off the wall and reached for the fire door, then stopped. "Did you know," she said, "before today, that something was off with him?" Whitford was quiet for a moment. A real moment, not a professional pause. "I had a feeling," she said. "The kind you can't put in a report. He was too careful about certain things, too fluent with the documentation gaps." She paused. "I didn't move fast enough on it." "You got there," Rachel said. "Not as fast as I should have." Rachel looked at her. "I spent 2 years thinking I was too slow," she said. "That if I'd been faster, sharper, better, one specific night, a man would be alive." She paused. "The answer turns out to be that the timeline was taken from me. But even if it hadn't been, even if it had been a genuine error in my assessment, spending 2 years inside that question and not moving isn't the answer." She paused. "Get there when you get there. Then move." Whitford looked at her. "That's going to stay with me," she said quietly. Rachel opened the fire door and went back to her floor. She finished her shift. She did it the way she'd done every shift for 2 years. Methodically, carefully, with the specific attention to detail that had been partly competence and partly penance, though she understood now that the distinction between those two things had always been thinner than she'd believed. She checked on Voss at 6. She updated her charts. She gave a full handoff to the oncoming shift with the precision that the night nurses had come to expect from her, and which 2 of them, tonight, acknowledged with a directness they hadn't used before. She was pulling on her coat at the locker when Deanna appeared. "Come get food with me," Deanna said. "Not the cafeteria. Actual food. There's a diner 2 blocks over that does breakfast at any hour, and I'm going to need you to explain everything that happened today while I eat eggs." Rachel looked at her. Deanna was 32 and loud in the specific way of someone who processed life out loud and didn't apologize for it. And she had known for most of 2 years that Rachel was carrying something she wasn't talking about, and she had never once pushed hard enough to make Rachel close off. That was a particular kind of intelligence that Rachel had never quite found the words to acknowledge. "Okay," she said. Deanna blinked. "Really? You're not going to say you're tired or that you have things to do?" "I'm tired, and I have things to do." Rachel said, "and I'm coming anyway." They went. The diner was the kind of place that had been on the same corner for 30 years and smelled like coffee and griddle grease and had laminated menus that nobody looked at because everyone ordered the same things. They took a booth in the back and Deanna ordered eggs and toast, and Rachel ordered coffee and then also eggs because she realized when the menu was in her hand that she hadn't eaten since 6 that morning. She told Deanna everything. Not in a structured way, not the way she'd told it in the conference room, measured and documented and careful. She told it the way you told things to someone who already knew you and was just waiting to be let in to the part you'd been keeping private. Deanna didn't interrupt much. She asked 1 or 2 questions, the good kind, the kind that weren't really questions but were more like signals that she was following. She ate her eggs. When Rachel finished, the diner had emptied out to just them and a man at the counter reading something on his phone. "Terrence?" Deanna said. "The one who died." "Yes." "You've been carrying him for 2 years." "Yes." Deanna was quiet for a moment. "Are you going to be okay?" Rachel wrapped her hands around her coffee cup. "I don't know what okay looks like yet for this specific thing. I know what it looks like for other things. This one I'm going to have to figure out as I go." That's a very honest answer. "I'm tired of the other kind." Deanna looked at her across the table with the expression of someone who wanted to offer something large and was trying to find the right-sized container for it. "You saved someone's life last night," she said. "While someone was actively trying to limit what you could do, you did it anyway." "I did it because I knew how," Rachel said. "That's not heroic. It's just knowledge." "Rachel." Deanna's voice was dry and fond. "Accept the compliment." Rachel almost laughed. It surprised her, the almost laugh, because she hadn't felt one available since the night before. "I'm working on it," she said. Getto. The paperwork the next morning took 2 hours and 20 minutes. It was held in a different conference room than the previous days, Sheb, larger, with a window that got actual morning light, which Rachel suspected was not accidental. Whitford was there as promised. 2 people from the records office, a representative from the hospital's legal team, which Pendleton had arranged without being asked, which Rachel noted as a gesture worth noting. The documents were dense and bureaucratic and required signatures in several places and initials in others, and Rachel read every word before she signed anything, which took time and which nobody in the room rushed her on. Her service record, as it now stood, reflected the accurate sequence of events at Black Horizon. The medical conduct citations that had been attached to her separation, implications of professional failure, of a compromised assessment under pressure, were removed. In their place, a formal commendation for actions under fire. A second commendation, this one for the specific intervention at 0214 that had kept 3 members of the unit alive long enough for extraction. A third, which she hadn't known existed, for a separate field assessment 6 weeks before Black Horizon that had caught a supply contamination issue that would have affected the whole unit's operational capacity. She hadn't known they'd documented that one. She read it twice. Corporal Terrence Mallow's file was updated the same morning in a separate process that Whitford described to her after the signing. His family had been contacted the previous evening. The honors that should have been issued 3 years ago were being processed. Rachel didn't ask about the specifics because she understood that peace wasn't hers to manage. It belonged to his family, and she hoped they found in it something that the years of silence hadn't given them. She hoped. That was all she could do. Whitford walked her out of the conference room at the end of it. "Warren Pruitt will face a military tribunal," Whitford said. "So will Ashby. The process will take months, but the outcome," she paused. "The documentation is solid. It's going to go where it needs to go." "Good," Rachel said. "There will be press." Whitford looked at her directly. "When the review closes publicly, the Black Horizon findings are going to be reported. Your name is in the record. People are going to—" "I know," Rachel said. "I'll deal with it." "You don't have to be available for any of it if you don't want to be. The record stands regardless." "I know that too." She paused. "I'll decide when I see what shape it takes." Whitford offered her hand. Rachel shook it. "You were owed this a long time ago," Whitford said. "Yes," Rachel said. "Simply, without softening it or deflecting it. I was. She was back on her floor by 10:30. Sandra met her at the nurse's station with the morning's assignment sheet and a look that asked everything and said nothing, which Rachel answered with a small nod that communicated, done, real, standing. Sandra handed her the assignment sheet. Rachel took it. They went to work. At 11, a message came through from the hospital administrator's office. Pendleton, requesting a meeting at Rachel's convenience this week, if possible, to begin preliminary discussions about the trauma training initiative. The message was carefully worded and did not attempt to minimize what had happened or package it with institutional language that would have made it hollow. It was a plain ask. Rachel replied that Thursday worked and left it there. At 11:40, Price stopped her in the corridor near the trauma bay. He looked like he'd slept badly, which she suspected was accurate. He'd clearly been working something through, in the specific way of people who were not accustomed to sitting with discomfort and were discovering it had a weight that didn't lift until it was addressed. "The story I was telling," he said. "The version of last night. I corrected it." She looked at him. "I told Ferris and two of the other residents who'd heard the first version." He said it with the difficulty that genuine correction always had when it required going back to people who'd already formed an impression. "I told them what actually happened." "Okay," she said. "I also want to say—" He stopped. "I know this is late, but I've been watching how you work for 8 months, and I categorized you wrong, and I kept the categorization even when I had evidence against it, and that's something I'm going to be sitting with for a while." She looked at him for a moment. He was young. He was capable. He had, somewhere underneath the professional arrogance that medical training had done nothing to discourage, the actual material to be a good doctor. Whether he became one was going to depend on moments exactly like this one, moments where being wrong had consequences and he had to decide what to do with that. "Good," she said. "Sit with it. Learn something from it. That's all I want." He nodded. She moved past him into the trauma bay where a new patient was coming in, a woman, 50s, chest pain and elevated pressure, the kind of case that moved fast if you let it sit too long. And she gloved up and started working, and the rest fell away the way it always did when there was someone in front of her who needed her to be exactly where she was. She visited Voss at 2 p.m. and again at 5. The 2 p.m. visit was clinical, wound check, vitals, medication timing, a conversation with the covering resident about his ambulation schedule. He was healing faster than the chart expected and slower than he wanted, which was a typical tension for people who had spent their careers treating their bodies as instruments. The 5 p.m. visit was different. She came in and sat down without the chart, which he noted. "Paperwork done?" he asked. "Done." He studied her face. "How do you feel?" She thought about it honestly, which she was still practicing. "Strange," she said. "I expected it to feel like relief, I think. A release of pressure. And there's some of that." She turned the word over. "But mostly it feels like waking up and realizing you've been sleeping in the wrong position for so long that you don't know what comfortable feels like yet. You know something has corrected. You don't know what to do with your body now that it has." He was quiet for a moment. "That's a good way to put it." "I'm going to help redesign the trauma training program here," she said. "Pendleton asked." I said yes. He looked at her. "Yeah?" "I have opinions about what people miss in ballistic trauma assessment," she said dryly. "As it turns out," he almost smiled. "As it turns out. And I'm going to talk to Colonel Hargrove next week about what the restoration means for options. Not to go back. I don't think that's the right shape for whatever's next. But to understand what's available." She paused. "I spent 2 years in a small life because it was the size I thought I deserved. I want to understand what size I actually am." He looked at her for a long moment. Something in his face had relaxed in a way that she hadn't seen before. Not post-surgical ease, but something more like the specific release of a person who has been worried about someone for a long time and has finally seen them clearly. "Terrence would have liked this version," he said. Her throat tightened. She let it. "I know," she said. "He was always telling me I worked too small." "He wasn't wrong." "No," she said. "He wasn't." They sat with it. The monitor beeped. Outside the room, the hospital made its sounds. "You should rest," she said eventually. "I know." She stood. "Daniel." She paused. "Thank you for calling them. Before I said I didn't ask you to, but I'm glad you did." He looked at her. "I know you are. You're welcome." She left. The last thing she did before leaving the hospital that evening was stop at the trauma bay. It was in the between-shift lull, the brief exhale between the evening chaos and the night's unpredictability. The bay was clean, reset, ready. 2 nurses she knew by name were at the station. The equipment was checked and staged. Everything in its right place. Waiting. She stood at the edge of it for a moment. She thought about the night before last, the soldier coming through those doors, the room erupting, the specific weight of knowing something and choosing to say it despite everything that made saying it costly. She thought about the person who had walked into this hospital 22 months ago and made herself as small as possible, as quiet as possible, as undemanding as possible, because she'd believed that was what she'd earned. She'd been wrong about that. The cost of being wrong about it had been enormous, not just to her, but to every patient who'd gotten less from her than she actually had to give. Every interaction where she'd pulled back from what she knew because the person in front of her had the authority to make her pay for being right. She wasn't going to do that anymore. It wasn't a resolution in the dramatic sense. It wasn't a single clean decision that would never need to be remade. She knew herself well enough to know that old habits of diminishment didn't disappear because the circumstances that built them had been corrected. She was going to have to choose, probably many times, in many rooms, to take up the space she'd learned not to take. But she was going to choose it. She'd been choosing it, without even fully knowing it, since Daniel Voss had come through those doors, and she'd stepped forward anyway. She turned and walked to the locker room and changed and left the building. Outside, the evening was coming in gray and cool, the parking lot half empty, the city making its ordinary sounds in every direction. She stood on the sidewalk for a moment and breathed it in. Her phone buzzed. A number she now recognized. Hargrove. She answered. "Darrow," Hargrove said, "I wanted you to hear this directly. The formal military commendation ceremony, we're looking at 3 weeks. Joint Base Merrill, if that works." Rachel was quiet for a moment. "It works," she said. "There will be media presence. Not a large event, but it'll be on record." A pause. "The fallen will be honored alongside the living commendations. I wanted to make sure you knew that, so you could prepare for what that means." She thought of Terrence, of his face the last time she'd seen him, of the specific weight of carrying someone's absence for years, and finally, being able to set it down somewhere it could be properly held. "Thank you," she said. "One more thing." Hargrove's voice shifted slightly, the professional layer thinning just enough. "You built something here. 2 years of difficult work in a place that didn't understand what it had. You did that under the wrong story, carrying the wrong weight. I want you to know that's not lost on anyone looking at the full picture." Rachel pressed her free hand against her coat. "I was doing my job," she said. "You were doing it better than you were required to," Hargrove said. "There's a difference. It matters." The call ended. Rachel stood on the sidewalk outside Callaway Regional Medical Center, the building lit behind her, the city stretching out in every direction. She thought about size, about the small life she'd built and the larger one she hadn't believed she was allowed to claim. She thought about all the rooms she'd stood in the corner of, all the assessments she'd made quietly, all the times she'd been right and let someone else have the room. She was 31 years old. She had most of her life in front of her. She had a record that now told the truth about who she was. She had skills that had been paid for at a cost she hadn't chosen and couldn't change, and she could carry them forward as penance, or she could carry them forward as purpose. She already knew which one she was going to choose. She'd known since she stepped forward in that trauma bay and whispered a classified phrase into a soldier's ear and felt, for the first time in 2 years, the full shape of herself coming back online. She started walking, not away from the building. She'd be back tomorrow, for the morning shift, for the patients, for the work that had kept her functional through everything and that she was good at and that she was going to keep doing because she chose to, not because it was the smallest available version of a life. She walked toward the diner on the corner where Deanna had texted her an hour ago to say she'd be there until 8 and the eggs were good. She walked like a person who was going somewhere. That was enough. For tonight, that was more than enough. The woman who had come through those hospital doors 2 years ago with her past folded and her head down had been trying to survive. The woman walking away from those doors now was doing something different, something harder and less certain and considerably more alive. She had been underestimated. She had been buried. She had been handed a story about herself that belonged to the people who needed her silent, and she had carried it until she couldn't, and then she had stood up in a room full of people who didn't believe in her and been exactly, precisely, irreducibly who she was. That was the thing about strength that looked like stillness. You couldn't take it from someone. You could complicate their ability to use it. You could put obstacles around it and paperwork on top of it and other people's voices in front of it. But you could not remove it from the person it belonged to. It waited. It held. And when the moment came, it was exactly as strong as it had always been. Rachel Darrow turned the corner and walked into the light.